So I know that most people think of like our body and the mouth as two separate things. Like you go to your physician to, get everything checked up, and then you also go to your dentist separately. There's actually more and more studies that shows that the mouth and the body are totally connected. So there it goes. Tooth loss and gum disease can actually increases your chance of Alzheimer's. And then a lot of times gum disease, which is perio issues, can increase head and neck cancer. I'm sure most of you guys have heard that diabetes is kind of a big thing right now with bleeding gums can also increase your chance of premature death. There's also a Surgeon General report that at least 80% of American adults have gum disease of some sort, okay? It is totally normal. This is stuff that we can prevent and stop. It does not have to progress. And some of the new research did show that the bacteria, so remember how sometimes when you go get your teeth clean, there's gonna be bleeding and all that, right? So that blood actually travels through the rest of your body. So because the bloodstream, everything is connected, right? So they have found some of those bacteria inside our brains and have been associated with Alzheimer's and all of that. Which is also why for some of our patients, if they have any kind of cardiovascular condition, we actually ask them to take antibiotics beforehand prior to any invasive dental treatment. So when I'm thinking invasive, it's like a deep cleaning or extractions, okay? So it's to prevent this bacteria from traveling. And then they also show that gum disease can actually increase pancreatic and kidney cancers. There's been some correlations that they found. The actual mechanism, we don't quite know yet, but there is an association. Also, people with gum disease are at a higher risk for diabetes. So we know that when your diabetes is not well controlled, it's gonna affect your wound healing and your sugar's not gonna be well controlled. The wound healing comes into play with your gum disease because essentially what we call gum disease is just inflammation inside your mouth, right? So with diabetes, your mouth is just not healing as well. There's also been some connection between gum disease and rheumatoid arthritis. This is still relatively new because I haven't found as much information about this, okay? Also, please feel free to stop me at any time. Sometimes I tend to talk really fast when I get really excited, so. Okay, so let's take a look at the mouth. I'm sure you guys have been to the dentist and then they start counting numbers, right? When they're checking inside your mouth and your teeth and stuff like that. So when we do count, we go from the right side all the way to the top to the left, and then we go from the bottom this way. So this is my right side. We'll go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to like 16 if you still have your wisdom teeth. And then we'll go down this way all the way to 32. Most people should not have their wisdom teeth anymore. I don't know. If you do, that's cool. Just remember to clean them because they're all the way back there. Like I personally am missing 2. That's just because they just never came down. I took an x-ray on myself and everything. They're just not there. Okay, so this is basically the number of teeth you should have. Now, let's talk about the anatomy of the tooth, because this will kind of help you guys understand why we do oral hygiene the way we do. So if you take a cross section, this is the white part that you see. This is what we call enamel. So this is the whites of your teeth, okay, that you see. And when people are talking about whitening, this is the part we're trying to change, okay? And then the inside, we have something called dentin. Then this is your nerve. So like when we say, oh, you need a root canal, we're taking out this part. So with the nerve at the bottom, there's apex or apices. Is that, yeah? Okay, anyways, ESL. And then this is where the blood and all the nutrients will transfer through, okay? And then this is your gum. Right beneath, under your gum is where the bone is. So down here, where the crown, this was what we call the crown, this is the root. Depending on which teeth that we're talking about, some of them might be single root, double rooted, or triple rooted. Some of you more extra special people can have quad rooted. Those things are not fun for me to take out, but whatever. It's a good time to be had by all. Anyways, so this is the anatomy. Just kind of want everybody to kind of remember this because this will come back into play. So you have the crown. We call this the neck. This is where like that pocket is. So you know how when you go to the dentist and they take a probe and then they start moving it around like 3, 4, 3, 1, 2, 3, and they're just calling out a bunch of numbers and you're like, what the heck are they doing? That's us measuring your pocket depth. Depending on where your pocket depth is, This is how we determine whether or not you have gum disease. And then this is the root. Questions, comments, concerns? We're good? All right. Okay. So, some of the common physiological changes as we get older, there are medical conditions. Then with these medical conditions, there's medications that go along with it. Sometimes, some of our older adults may have poor oral hygiene, but a lot of times it's because they start losing their manual dexterity. You may not be able to operate a piece of floss as well as maybe you did in your 20s. So this could be a cause of it, but we have other stuff that can kind of help mitigate that. But the most important thing is aging alone by itself should not play a big role in impaired oral health. I know that there's a whole myth going on, and we're going to dispel some of them today, where people think that, hey, once you get older, your teeth are automatically going to go bad. No such thing. That is not true. If you take care of it, we should be able to cut it right then and there. Because the goal is to, I don't know, my goal is to live to like 100, so we'll see. I mean, there's a whole like new Netflix show called The Blue Zone. I don't know if you guys have heard of it. They talk about like the areas with the most centenarians. I thought that was kind of neat. Anyways, oh, I forgot my laptop's there. There we go. Okay, so some of the common oral health problems that can occur. So the first thing, caries. This is more of a technical term that we use, but it's just basically cavities. Okay, caries or carious lesion. Periodontal disease, so we're talking about your gum disease. Dry mouth, which a lot of my older adults do complain about just because of the medication they're taking. And we're gonna talk about this in a bit too. Oral cancer, the loss of masticatory function, so you're unable to chew and eat as well. There's also possible for excessive tooth wear. Loss of tooth, oral candidiasis, which is fungal infection. More often for people with dry mouth, there's a connection there. And some of my older adult patients have complained of altered taste. With the whole oral candidiasis or the fungal infection, it does happen a lot more often with people who are wearing removable or like dentures, partials, and stuff like that. Whether it be a complete or a removable one, and we can talk about all of that too. All right, so first myth, only children get cavities. That is a lie, because tooth decay can happen at any time, provided that you have natural teeth, okay? So what happens is, remember that picture initially that I was like, guys, remember this? So what happens is, if we don't floss properly, there's gonna be dental plaque and food debris that build up. And most of the time, if we can't get them out, or if your mouth is dry, so the saliva doesn't kind of work as a barrier to wash all that food debris away, what can happen is these cavities, these little plaque, they start, okay, so this is what I tell my pediatric patients. So you have sugar bugs living inside your mouth, right? And these sugar bugs, because inside our mouth, we have normal bacteria, good and bad bacteria, just like in our gut. Totally fine, totally normal. So, with that, oh, by the way, it's not COVID, I tested, okay? This is post-nasal drip. Sorry, guys. And what happens is the bacteria inside our mouth use the food, the leftover food that's inside, and then they start breaking things. They create byproducts, right? So for the kids, I'm like, this is basically sugar bug poop, okay? So you don't want poop inside your mouth, that's why we have to clean, okay? Now normally, the cavity that are in between the teeth, they will start in between here and the whites. Usually when they're still in enamel, I usually just say, let's just watch it. Unless it's really ugly and it is an issue for you and you want to take it out. Because I personally, I have a few of these in like my back teeth that haven't progressed into the dentin yet, so we're just monitoring those. But once it progresses into the dentin, we do have to treat it. That is a real cavity. Usually what happens when you need a root canal is these decay have progressed so far that it hits your nerve. So I'm not gonna ask because, HIPAA and stuff like that, but for those of you who probably have had a root canal, remember right before you got your root canal, you're like, oh my God, my tooth hurts so much, right? So, why that happens is because these cavity and these bacteria have reached the nerve. Unfortunately, most of the time, let's say if we get a cut or whatever and it's healing, it oozes out. So there's a place for that bacteria, pus, and all that stuff to drain to. Unfortunately for your teeth, there's nothing to drain to because the entire canal is enclosed, if you guys remember the previous picture. So that's why right before you do need a root canal, you're gonna feel like, oh my God, it's blowing up and this thing totally sucks. Okay, I'm sorry, I've never had a root canal, so I can't relate. But I will tell you, I've had multiple cavities. And then this is usually what happens. It will turn black like this, but not all black stains are cavities. Okay? All right, so what can we do? We're gonna brush our teeth with toothpaste that has fluoride in it. I know everybody is moving more towards like the natural, I guess, remedy, but fluoride is actually good for you. The amount that's in there is not as damaging as people would think. Okay, so please still buy toothpaste with fluoride. Now, for those of you prettier ladies who want to whiten your teeth and everything, okay, meant to, I'm sorry, I can't be discriminatory here. But I know for a while charcoal was a really big thing. Please don't use the charcoal too much because that actually is very abrasive. Okay, I know this is a bit more anecdotal, but I did have a patient, young girl, like 17, 18. And so she comes in and I'm like, why are there white spots on your teeth? Because then it looks like they started, so your enamel is actually just a bunch of minerals. What happens when they start breaking down, they'll turn into white spots or different colors. That's what we call demineralization. This is the precursor to basically a cavity and stuff like that. Your teeth, the front, the whites right here, it could change color. So then I was like, what are you doing differently? Then that's when she told me that she started using the charcoal toothpaste to make sure her teeth are nice and white. But you know, if you use too much of it, because it is abrasive, you could end up actually damaging your enamel. So it's fine. There's nothing wrong with wanting white teeth and everything, but you know, just be careful. And then in LA County, all of our tap water is fluoridated. Yes, sir, did you have a question?
Is it okay to add baking soda to the water that you?
So everything that I recommend, I have tried on my own. I personally really don't like the baking soda texture. Like that's my personal preference. You can try it, but like when I did it, I was like, oh, what is this? Like I can't. I didn't like how like it didn't. I know like is it Arm & Hammer, the baking soda brand? They also came out with their own toothpaste. That's kind of the same concept. I really didn't like it just because it didn't foam, and so I don't like it. Some of my patients love it, but I will say everything that I would recommend, I have tried on my own. So I don't know if does that answer your question.
Any additional benefit if I add a little bit of the baking soda to my rinsing water?
You can. I don't see the harm in that. So the whole reason why they talk about like your mouth and the baking soda, because the baking soda is basic, right? So your mouth is actually pretty acidic. So we're talking like, you guys remember the pH scale and stuff like that, right? Your tooth starts decaying when it reaches a pH of 3 to 4. So that's where I think that baking soda concept came into play. So yeah, it works, but if it works for you, great. But there's no like, I can't really recommend it because there's no like literature evidence base behind it. But I have heard a lot of anecdotal stories that it works. So does that help? Yeah. I can tell you the toothpaste I use. I just use Sensodyne because my mom buys a bunch from Costco and I'm like, hey, I need toothpaste, and then I just go home and steal it from her. So that's what I use.
What about using salted toothpaste?
Salt toothpaste.
Yeah.
I haven't seen that before. Is that available on the market?
Oh, not here. You get it from Japan.
Oh, okay. Because I like to walk up and down the aisle at like CVS and like Target, and then like I like to look at the oral healthcare product. I've never seen that before. I have seen charcoal, fluoride free, and like all the other stuff. And I've also seen some of the other floss and some of the electric toothbrushes. Some of those electric toothbrushes to me are a little bit questionable. So I will tell you, I'm probably one of the most laziest like person you'll ever meet, okay? I love the electric toothbrush because you literally just hold it, right? And you just let it do its thing. The problem is sometimes you guys get really excited. Oh, okay. My mom gets really excited, so then she'll like brush while the toothbrush is brushing, and I'm like, Mama, you're doing this twice. You only need to do it once because you're brushing double and you're gonna end up damaging your gums. So, just a thought, if you're gonna use an electric, just hold it. There are some electric toothbrush that kind of oscillate straight up and down. There's other ones that go in circle, and there's other one that like, I have no idea what the heck it does, because I'm just like, what is this? Like, the one that I tried that I did not like at all was, for a while, they were like all the rage at Target, Quip, which is kind of like a subscription-based thing where they'll like mail you toothpaste and mail you toothbrushes and stuff like that. So I tried that. I did not like that. I actually use Oral-B, but that's because before I was using Sonicare, because Sonicare came to school when we were dental students, right? Get them when they're young for brand loyalty. And so I used Sonicare for the longest time, but then like I felt like the back wasn't as clean, so then Oral-B was having a sale, so then I bought that, and then I was like, oh, it's kind of nice, because the Oral-B, I like that it goes in circle. And for me, like it's harder to get to the back. I don't know for some of you guys if it's easy for you to open wide to get back there, so just a thought. Again, some of the stuff is personal preference. So I haven't heard of anything with the salt, but if it's salt with like warm water, then that makes saline, so I guess it clean out to make it.
A friend of mine, she using baking soda and salt.
Oh, okay.
She never used toothpaste.
Oh.
She never uses she said her dentist advised her to do it. She using baking soda and put the salt in there, and then she just.
That's cool. If it works, great. You know how for a while they were talking about like coconut oil pulling, where like you rinse with coconut in your mouth for like 20 minutes? Yeah, that's what they were saying. And then I actually tried, I was like, oh, this is so gross. I didn't even make it past 2 minutes. Just like the consistency of it, so, okay? But definitely, you do still want to brush with an actual toothbrush. And then floss regularly and routine checkup. So, the next thing is, okay, so gum disease is a part of getting older, which is totally not true because we could prevent gum disease. It does not have to be a part of getting older. A lot of times we think older adults just get gum disease, but that's because we've already had a lifetime accumulation of the gum disease. So let's look at this picture first. Healthy gums, nice and pink. It should be up here where the crown is, where it meets the root. Here's your bone. What happens in gum disease is all this like food and plaque and bacteria start accumulating right in here in the pocket. So this is what happens. We call it tartar plaque. Once it gets hard, we actually call it calculus. And at first I was like, oh, like the math, calculus, huh? And then I remember this other thing that my faculty had said when I was younger. He was like, Asians have more tenacious calculus. So, my Asian audience, please, apparently we gotta floss better. Most of us though, what I've noticed is we do accumulate a lot of the plaque and tartar on the bottom front teeth and the tongue side. But it makes sense because that's where like your tongue is. Sometimes like food gets in there. Sometimes like it's a food trap. So right here, if you don't clean it properly, what happens is all of this plaque and debris, we actually call it the like correct name, I guess, is biofilm, right? Because it's a bunch of bacteria that's in there. What happens is it could start going down, causing inflammation of the gums. And then once that happens, it can actually destroy the bone and causes reduced bone level. So in people who have periodontal diseases, what happens is your bone is lower than this, right? Your root is embedded in the bone. When you don't have enough bone to hold that root in, this is how your tooth or teeth becomes mobile. And that's why it's like flapping in the wind. Okay? So a lot of times the plaque and tartar does cause irritation, and a lot of times it is not painful until it moves to the advanced stages. So most people have some mild form like gingivitis, and this is usually reversible with good oral hygiene. Your gums might be red and swollen and bleeds easily. The one big misconception that I would like to clear up is it's bleeding when you floss, but you gotta keep flossing. Don't stop flossing just because it's bleeding, okay? You gotta keep flossing. Okay, because then that will kind of reduce the inflammation. And then periodontitis is a bit more severe. There's actually also different stages of it. And this is when the surrounding tissue and bone are being damaged. So your gums will end up pulling away from the teeth. So when they did the measuring for you guys, like I'm sure you heard like 4 or 5 or whatever. 1, 2, 3 is normal. Anything 4 and above means that you got inflammation. So, not gonna lie, I have a few in the back, like it'll just be like 1, 4, 1, 5 there. If it's just 1 or 2, nothing to be alarmed about, okay? It's only when there's multiple high numbers, then we're gonna be concerned. So, I'm a visual learner, I love pictures. This is what healthy looks like, okay? Everything's fine, you have enough bone level, everything's so pretty, nice and pink. In gingivitis, the gums are a little puffy and inflamed. In moderate periodontitis, you have more of bone reduction, and then your roots aren't showing yet, right? But the gums, the tissues are kind of pulling away. In severe periodontitis, by the way, this probably takes years to accumulate, and do you see how you can see the roots now, this yellowing part? Yeah, and then like how this is all pulling away. Once you lose more and more of the bone, this tooth is gonna be mobile. And then even like, I won't be able to save that. Okay, so just a thought. And so what can we do? Of course, brush 2 times a day. Remember to floss and then visit your dentist for checkup and professional cleaning. Try not to smoke and chew tobacco because that can also affect your periodontal health. This is still relatively new, but I put it in here because there is some new research about that. Eat a well-balanced diet. Now, for my older adults, a lot of them will have difficulty with their hands, the manual dexterity to kind of get that floss in between there, okay? So they do have a lot of other modified oral hygiene instruments that can help with this. We can talk about this because I have my own feelings about these, and of course, like, some of these things that I needed like an older adult to try, I had my mom do it. So she's turning like, oh yeah, tomorrow's her birthday, she's turning 69. So I'm like, Mom, try these. And so she actually tells me that some of these are not as easy to use. But I have like pictures of a bunch of those later, and then I'll show you guys, and then we can go over them if you guys have any questions and comments. So they've also found, that's why perio is important, because they found that it does affect your cognitive function, kind of like what we talked about. They have found some of the bacteria able to travel up to the brain because there's like a very thin blood-brain barrier. Cardiovascular condition, because of the bloodstream that connects everything. There is also a potential risk of cancer being increased. But I feel like nowadays everything can cause cancer, so. All right, the other thing, dry mouth is a normal part of aging. That is not true. It is not a part of normal, healthy aging. A lot of times it's the medications that we're taking. So some of the biggest culprits are some of your antihypertensive, some of your antidepressants can cause dry mouth. There we go. So what is dry mouth? A lot of times it's when you don't have enough saliva inside the mouth. And when you don't, that usually will affect with your chewing, swallowing, talking. If you wear any kind of appliances, you probably will not be able to keep that appliance in. And this is usually what dry mouth looks like. The saliva is really thick and ropey. And because the saliva is not there to wash away, there is an increased chance for tooth decay because all that food and all that gunk just kind of gets stuck in there. And a lot of times it's caused by medications and potentially other systemic conditions, so like Sjogren's syndrome. So some autoimmune condition can also cause this, okay? And how we check for dry mouth is we usually ask the patient, but a lot of times I feel like dry mouth is very subjective because I could be like, hey, you know, sir, do you have dry mouth? And you'd be like, no, and then I go and check and I'm like, okay. But basically we take a mirror and then we kind of drag it along the side of your cheeks to see if the mirror drags or if it kind of sticks a little bit, okay? Okay, so what can you do? Of course, see the dentist, see the physician to determine the cause. Unfortunately, a lot of times they will not be able to adjust your medication. Okay, so then we can provide symptomatic relief like drink more water, artificial saliva, and frequent checkups. And I know for some of the like over-the-counter products for artificial saliva or stuff for dry mouth products, so biotin, that's the most popular one. So with that one, I don't know if you guys know, but recently GSK like bought them, so the formulation has been changed. But if you're using it and it works for you, by all means, go ahead, continue to use it because a lot of this I think is a bit more subjective and personal preference. But a lot of times we do recommend patients to, you know, suck on some sugar-free lozenges or if they have cough drops and stuff like that. I'm not a fan of telling my patients to chew gum because some of them are a little bit older and if, you know, they accidentally choke on something. So, and then a lot of times some of them do complain of temporomandibular joint pain right here. And that could sometimes be caused by like grinding teeth at night that they just might not be aware of. Okay? Now the other thing is, if you don't use chewing tobacco or smoke, you don't need to be screened for oral cancer. That is not true. The tobacco is not the only risk factor for cancer. So tobacco, of course, at any kind will increase your risk as well as heavy alcohol use. And unfortunately, the likelihood of oral cancer, and to be honest, like all cancer, does increase with age. And a lot of time, pain is not a symptom of the disease. So normally when you do come to a dental clinic and you're a brand new patient, they should be kind of massaging your mouth like this to just check for any weird lumps and bumps. Usually what I say is when you're brushing your teeth or cleaning, your mouth and stuff like that, if you see any weird lumps and bumps that don't go away within 2 weeks, please call us, okay? It doesn't have to be us, call your dental provider, because let's just rule out any potential for whatever it is. Most of the time, oral cancer though will happen at the lateral border of the tongue or on the base of the tongue, so the floor of the mouth. Okay, there we go. So, all of these are things that I've seen in my practice. This is actual cancer. This is squamous cell carcinoma. This is from an aspirin burn. Because I know a lot of you guys are probably taking 81 milligram aspirin for cardiovascular protection and stuff like that. One of my patients placed it too close to like his cheek right there, and there's an aspirin burn. This is denture stomatitis. So this patient's wearing a complete denture. If the denture does not fit well, it could also cause irritation like this. Sometimes they do have white plaques like this. When they do, we usually like to note it and just kind of keep in mind and monitor it, because it could be nothing, it could be something, we don't know. It could go either way. This is just a canker sore, like if you get too excited and then you bit yourself. But these should resolve on its own within like 14 days. If it doesn't resolve, then come see us. This is what a fungal infection looks like. What happens a lot of times, yes, we all have fungus inside our mouth, it's not that big of a deal. These only come out when you are immunosuppressed. So, meaning like if you're on a course of steroids, if you have to take any immunosuppressants, okay? So a lot of these we'll see in some of our cancer patients or if they have any like immune conditions. Okay. So let's talk about oral hygiene. Brush 2 times a day for 2 minutes with fluoridated toothpaste. I'm sure all of you guys have a smartphone. All of the fancy new electric toothbrushes now, you can hook up to an app. Yes, I roll my eyes because I use the same thing. It'll set the timer on its own, and then like the teeth will change colors to make sure like you got everything. You want to place a toothbrush at a 45-degree angle in circular motion. This is the biggest thing. Remember to brush your tongue. You don't need to get a fancy tongue scraper. You can if you want to, but you don't need to. Really, to brush your tongue, stick out your tongue and just brush it, and that's it. Also, remember to replace your toothbrush every 3 to 4 months. When the bristle starts opening like a flower, that's what I tell my mom all the time. It is time to replace that toothbrush, okay? Like, no, don't keep using that inside your mouth. And then of course, flossing at least once a day. I know this is probably the hardest part. Not gonna lie, I only floss once a day at night. So then I floss, then I brush. Just so we can like break out the big pieces first and then brush it. So, I think I'm just gonna show you a video that might be easier. So mainly, like I tell all my patients, when you brush your teeth, just brush the ones you wanna keep. Oh, they got it, all right.